Is this where I call to ask questions about getting on birth control from the health department?
Yes, it is.
All right, thank you. So, what is required of me to get on birth control through you guys?
An appointment, and then there's quite a bit of paperwork because it is a federally funded program. And have you been here before?
No, this would be my first time.
Okay, and are you currently on a method?
No.
Okay, and that's okay. All of that's okay. Okay.
Yeah.
And we just need to set you up an appointment, and you come in. Now, do you have insurance?
And what would happen at this appointment?
So, how old are you?
26.
Okay, so this is what we would call a delayed, okay, or an express, meaning that we would get you started on birth control, but we wouldn't do any physical exam. We would have you give us a urine sample that we do a pregnancy test and a chlamydia gonorrhea. We do your height, weight, and blood pressure and go through your medical history.
Okay. And, like, after that initial express exam thing, would I have to come back in and get, like, more exams?
Well, that's not an exam, okay? That's just a visit.
Okay.
But yes, you would be required to come back in. Typically, women get 3 months worth of birth control at that first visit. And then before they finish with their 3 months, they come back in and do what we call an annual exam.
Here we see another example of a clinic giving people just enough of the prescription to make them reliant on it, and then springing a medically unnecessary exam on them to circumvent informed consent. I've noticed multiple clinics using this tactic since I've started making this series.
Not every woman needs to have a physical exam, depending upon the situation. If you've had a PAP already, if you've already had an exam within the last year.
Basically here what she's saying is, if you just automatically do what we want without being forced, we won't force you to. That's not informed consent either.
Then you don't necessarily need to have an exam.
And is the exam required?
Yes. So why would you not want an exam if you've never had one?
It's kind of a personal reason.
Okay. Well, I would say because we have our guidelines, you might want to talk with a physician about that, giving you birth control at 26 without ever having had a pap smear done. Because guidelines say a young woman should have one at 21 and then every 3 years.
And here we see this nurse just completely contradict their own guidelines. She just said I would have to have had a pap smear in the last year to be able to obtain this prescription. But then she turns around and says that pap smears are recommended every 3 years. So which is it? Are they recommended every year, or are they recommended every 3 years? If they are recommended every 3 years, why are you requiring them every year? Somebody make it make sense. I guess I'm just a bit confused about where that correlates with birth control.
Because it's hormone, hon. And hormone can, if a woman were to have a cancer, hormone is like putting kerosene on a fire.
I particularly like how she used the fire analogy here to instill a sense of fear and urgency and importance. Especially given that this clinic is located in the Southwest, where we really don't have a lot of serious natural disasters other than wildfires to contend with. And many of us have felt the panic of waiting by the phone to see if you're going to be evacuated from your home as a result of a wildfire. This is a very dramatic and fear-inducing way of letting me know about one of the risks I might face taking birth control.
It accelerates it. So it would not be wise to give a woman who has a cervical cancer birth control.
Yet, not one reputable health organization supports correlating birth control with pap smears or forcing women who want to use birth control to screen for cervical cancer. Nobody supports that. Absolutely no reputable health organization supports that. Okay, but what if I just decided I'd rather avoid the exam and just take that risk?
Well, that's where you wouldn't be able to do that through our department, okay? That's why I think that maybe if you found a personal provider, they may be able to do that for you. So say people who don't have insurance, we usually tell them that River Valley is a good place to go. That way you could have a personal provider, and it's on a sliding scale fee.
Okay. So basically,
so that might be enough.
Basically the pap smear is required from you guys.
It is. Yes, it is, hon. At your age, yes. If you were under 21, no. But because you're over 21, yes.
I guess I'm still a bit confused about this because I actually did quite a bit of research on this prior to calling, and everybody else, including like really reputable organizations like the American College of Obstetrics and Gynecology, says there is no reason to require a pap smear to prescribe birth control.
So, hon, why don't you go online and buy it?
And this is how I know these nurses know what they're doing is wrong and not supported by evidence. Nobody who doesn't know that is wrong, nobody who doesn't have a guilty conscience is going to get so defensive and reactionary and snap at someone like this. Especially someone who asked a fairly innocent question about recommendations in what I consider to be a pretty respectful way. But to answer her question, a lot of women and AFAB people don't go buy it online because, one, they don't know that's an option, and two, because they can't afford to. Online options are sometimes not covered by insurance. For a lot of people, the local health department is the most accessible and affordable option, and sometimes their only option. I just wanted to call and try to find out, like, what's going on here.
What's required, and so I just told you what's required, sweetheart. That's what I told you.
Wow, that's quite the condescending and belittling response. And if I was seriously considering going to this health department for my reproductive health needs, this would absolutely put me off of doing so. I understand these requirements are not this nurse's fault and she did not implement them. But her condescending reactions to being questioned about the requirements she works under are absolutely ridiculous and an absolute no from me.
Required through the organizations that provide that for us. That's what we are required to do.
Okay, and do you know who I might be able to contact and talk to about why that's a requirement? That, like, I understand it's not you making these rules and you can't change them, but who could?
That I don't know, because we have several organizations that get together, and it's through our funding, okay?
Okay.
And I think that you hit on those, okay, already. And if they're saying it's not, but that's not in our, it's not in our policies that is written by those organizations. They may say it's not required, but they make it required through us.
Now, this claim is very interesting to me, and it is definitely a thread I'm going to be pulling on just to see if it leads to anywhere. Oh, okay, that's honestly pretty stupid, but thank you for the information anyway.
Well, I'm just saying.
Oh, I understand. I understand it's not your fault.
Yeah. But there are ways to avoid it.
Yes.
But you take risks again. Okay?
Yeah.
You take risks again, and people do it all the time. It's their choice to make, those risks. We all take risks every single day.
We do.
Do I want to get in a car and possibly getting in a wreck? Yes,
yeah.
I do, because I need to get to work.
Yes.
Yeah, I want to take that risk. So, I understand that, and it is shouldn't be given that option.
I understand.
But I'm telling you what our organization says.
Yes.
Okay.
At this point in the conversation, I can hear genuine sympathy in this woman's voice, which again shows that these providers essentially being forced to force exams on patients know what they're doing is wrong and not evidence-based and not actually recommended. They know this hurts people and they know it's wrong, there's just nothing they can do about it. This just further proves what a deep-seated systemic issue this truly is. And how it is not just affecting patients, it's also affecting providers. Well, thank you anyways.
Yeah, I even gave you some options.
You did.
That don't require it.
Yes. I'm obviously not a mind reader, and I don't know for certain what is going through this nurse's head as she's talking to me. But to me, the way she apologizes and seems genuinely sympathetic and talks about giving me options sounds a whole awful lot again like a person who knows that something wrong is occurring here and knows that they are a part of that and feels guilty for it. I think her knee-jerk reaction was to be,
yeah, I even gave you some options.
You did.
That don't require it.
Yes. I'm obviously not a mind reader, and I don't know for certain what is going through this nurse's head as she's talking to me. But to me, the way she apologizes and seems genuinely sympathetic and talks about giving me options sounds a whole awful lot again like a person who knows that something wrong is occurring here and knows that they are a part of that and feels guilty for it. I think her knee-jerk reaction was to be very defensive, and then I think she started really listening to what I was saying, and she started to think, like, I don't know what this woman's experience is, I don't know what she's been through. There could have been so many things in a person's past that would make them reluctant or unwilling to have an invasive exam like a pap smear. She's probably thinking, what if this person has been a victim of violence? What if this person has already had their consent stripped away from them? And then myself and my clinic are stripping it away again, essentially. We've seen time and time again throughout this little birth control series here on my page, how when it's put in the context of you are requiring someone to do something they don't want to do and are not comfortable doing with their body, it really clicks for them. They really get it. And that is, in part, why I'm making this series as well, is to make healthcare providers also think critically about this and see the error of these ways.
Okay.
Alright, well, thank you anyway.
You're welcome.
Bye-bye.
Bye-bye.